Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and today is February 24th, 2022, with another of our COVID conversations. We've got some good questions this week at Facebook questions at douglaspublichealthnetwork.org, and we'll get to those in a bit. But for right now, we've got pretty much good news on COVID, and I'm really excited to share some of that news. So as always, we start at the world level and then move our way down. And in the world level, COVID is clearly going down. And most of the places that had a lot of COVID just a few weeks ago, Europe and North America, really have slowed down quite a bit, which is great news. Still seeing some disease in Africa, but it hasn't spread as much in Africa as we feared. And we're still starting to see some cases in South America. But overall in the world, the number of cases is down. Almost all the cases have been Omicron. Now, there's a subvariant of Omicron called BA2, which is seen in some countries, but it is not widely spreading. And there are no new other variants of concern. So that really is good news. In the world, the only places that are struggling a lot right now, Denmark is unusual. Denmark is unusual in two ways. First is it's had a little more of the BA2 than the BA1, which is that subvariant of Omicron, and they struggled with a bit more disease than other places. The other place that is interesting to watch is Korea. So South Korea has had very few cases early on, but they've had a bit more cases now, probably their highest ever. They've got a high vaccination rate, so although they're having a fair amount of disease, they're not having that many hospitalizations or deaths. In the U.S., things have really quieted down. Those places on the East Coast that started with a lot of disease, like New York and Maryland, now have very low levels of cases. And the U.S. overall has a relatively low number of cases. Still in Alaska, Tennessee, West Virginia, and some of the western states, we're seeing a little bit of activity, but pretty much it's going down. And similarly in Oregon, it's going down. So each week, we've had about half as many cases the week before, which is about what we've seen in Douglas County. So a few weeks ago, we were over 1,000 cases in a week. This last week, we were just at 250. So things are coming down, and we expect them to go down even further. Hospitalizations, which we worried about, were really high in Oregon, over 1,000 a few weeks ago, now down to the 500s. And we think over the next few weeks, it'll go even lower. In Douglas County, we peaked at about 40 hospitalizations, and now we're down to about 20 hospitalizations. So all of those things look good. So for the first time in the pandemic, I'm optimistic, because for the very first time, any time in the pandemic, we have 5 important things at the same time. So the first is you have to have a low case count. With a high case count, we worry about the disease spreading to lots of people. Our case counts are coming down. We're in the 20s now, 20 per day, but I think we'll probably get lower than that, probably 10 to 20 a day. So we'll have a low case count, we'll have a low hospitalization rate. The third is that there are no bad variants on the horizon. If there was a Delta variant, an Omicron variant lurking in another country, we worry that it would get here. But right now, we're not seeing any of that, and that is good news. The fourth is that we have a very effective vaccine that's widely available. And so anybody who wants to get vaccinated can get vaccinated. Anybody who wants to get boosted can get boosted. When I look at our deaths, and we did have a lot of deaths this week, they're among people who either not vaccinated or are vaccinated but then did get boosted. We are seeing very, very, very little bad disease and very, very little deaths among those who are vaccinated and boosted. So please go ahead and get your booster. They're widely available at clinics. Our drive-through site is open at least through the weekend. So please go ahead and get boosted if you can. We're also seeing with COVID that restrictions are going to change. So they announced just today that the general mask mandate and the mask mandate for schools is going to be gone as of March 19th. So that less than a month from now, those mask mandates will be gone. That'll be a great thing. And I think when we look towards April and May, we could have some of the best months we've had at any time during the pandemic. Let's get to the questions. So one of the questions that came today was a question about, well, of the people who are in the hospital, how many are there because they have COVID, and how many are there and happen to have COVID? And so when we look, the numbers vary day to day, but we look at these hospitalizations every day, and generally 10 or 20% of the hospitalizations have COVID, but are not in the hospital because they have COVID. And so these would be, for example, a pregnant woman who has a mild case of COVID, who's ready to deliver her baby. She's hospitalized not because she has COVID, but she's hospitalized because she's delivering a baby. That she has COVID is important because she still needs to be isolated so she doesn't spread it to others. And it still requires other things for the hospital to do when people are positive. So people delivering babies make up a big number. Sometimes people are going in for elective procedures. And sometimes we see people who are getting behavioral health treatment also positive. So how many are there because of COVID, and how many have COVID but are not there because of the COVID? About 80% have COVID and are there because they're sick from COVID. 10 or 20% are there and are not sick from COVID. Another question was, what happened to flu in the last 2 years? And flu has been remarkably low in the last 2 years. I mean, really tremendously low. And there was a concern that maybe we're calling things that are really flu COVID. Well, we have very accurate tests to detect flu and COVID, and there's no overlap between these two viruses. So we know who has flu and has COVID. We've had a couple of cases of COVID, of flu. We've had a couple of hospitalizations from flu, but really we've seen very little flu this year. And why is that? Well, flu is not very contagious. So flu has a reproductive number, that is how many people get it from an individual case. With flu, it's only 1 or 2. With COVID, it's 5 or greater. So flu is much less contagious than COVID. And the things that we do to decrease the spread of COVID, stay home when you're sick, wear a mask, work far better against flu than they do against COVID, actually. And that's why there's been very little flu. We think if next year COVID is gone, that we could see a real resurgence of flu. So we're hoping that people will go ahead and get a flu shot next fall. Third question was about vitamin D. And so vitamin D has been very interesting during this pandemic. There have been numerous studies that show that if you measure vitamin D levels of people who are admitted to the hospital, that people who have low vitamin D levels tend to do worse than people who have higher vitamin D levels. And when you look at people get admitted, they tend to have lower vitamin D levels than the general population. So is it this deficiency of vitamin D that is making people more susceptible to COVID or more susceptible to serious cases, or is it true but not causal? And we just don't know the answer. We know that people who are sick with other conditions tend to have low vitamin D levels. They also tend to get sicker with COVID. But do they get sicker because they have low vitamin D levels, or is the same thing that's causing the low vitamin D levels also causing the susceptibility to COVID? Again, we don't know that. There are some studies that look and come to the conclusions on each side of that argument. What we do know pretty clearly is that people who get COVID, if they're given a big dose of vitamin D when they enter the hospital, it doesn't seem to make a difference. Now, will it make a difference if you take vitamin D beforehand? We don't know. But vitamin D is easy, simple, cheap. And so if people want to go ahead and take extra vitamin D, that is perfectly fine. You can buy a year's worth of vitamin D for under $20. So if people want to use vitamin D, I have absolutely no trouble with that. Vitamin A and zinc are other things that people are taking. And again, vitamin A and zinc are available. They're relatively inexpensive, and we don't think they're all dangerous. So if you want to take vitamin D, if you want to take zinc, if you want to take vitamin A, again, I have no troubles with that. But I don't think there's any good data to suggest that those things work. Another question that came up is, what's new with ivermectin? Nothing much. There was a study that came out of Malaysia this week that looked at people who got ivermectin, people who didn't. It didn't appear to be any big difference. So again, I don't think ivermectin really works well. This was a relatively small study. I'd love to see a big, very well done study to see if ivermectin helped. But right now, it looks like it probably doesn't. However, there is good news, is that there are 3 drugs that are out there that we do know work. One is called sotrovimab, which is an infusion which you can get after you get COVID. And although we're seeing fewer cases, we still are seeing some. And so if you're at higher risk, ask your doctor about using sotrovimab. The other 2 are oral pills, one called Paxlovid, the other one called molnupiravir, and those are available also. So if you get sick with COVID and are in one of the higher risk groups, talk to your doctor about getting one of these oral antiviral medicines that could decrease your risk of getting severe disease or hospitalization. So again, I'll recap by saying that things are looking pretty good with COVID. We're seeing declining number of cases, declining number of hospitalizations, no new bad variants on the horizon, plenty of vaccines that really seem to work, and oral antiviral medicines and the infusible antiviral medicines that are out there. So overall, things are looking really good. I hope we're going to wind up with a very good spring with low numbers of cases, and that people can get back to those enjoyable things that they've enjoyed in the past. But still, over the next 2 weeks, we're still having a moderate number of cases. So still be careful about big groups. And if you've not yet gotten your booster, please go ahead and do it. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thanks, and we'll join you again next week. Again, if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org. Thank you.